The theme for World TB Day 2026 is Yes, we can end TB. It is a hopeful message that says ending tuberculosis is possible even with today's challenges. If countries take strong leadership, put more money into the fight, quickly use new World Health Organization or WHO advice and tools, act faster and work together across different sectors, then ending TB can become a reality, not just a dream.
In a workflow, national doctor as well, everybody who comes to the hospital must know about TB.
We also detect the 10 color to detect the other.
The WHO Global TB Report 2025 shows that in 2024, about 10.7 million people fell ill with TB and 1.23 million died, a 2% drop in new cases and a 3% drop in deaths compared with 2023. TB remains one of the world's top 10 causes of death and the leading killer from a single infectious agent. And in Papua New Guinea, TB remains the country's leading cause of death. Case numbers are climbing, and 2026 efforts are focused on faster diagnostics, mobile screening, and training health workers, especially for drug-resistant strains.
Taking this long journey together with the patient to ensure that they're able to complete their treatment.
The government focus now is to fight this deadly disease, and this fight against TB in Papua New Guinea requires all partners to work together, and with innovative technologies available, we need to look at modern solutions.
1, 2, 3, 4, 5.
National Capital District Provincial Health Authority, during the commemoration of World TB Day at Gerehu Hospital, launched the Systematic Screening Intervention or SSI TB program. This new initiative comes with the introduction of artificial intelligence or AI portable X-ray machine designed to detect TB at its earliest stages.
To support in allocating resources to community health program in their respective provinces, in their respective districts. Today we will be launching this TB screening here, which is a tool, very portable. It can get to any community and it will be able to tell you whether somebody could be having TB and further investigation is needed. Today's theme is very important for me. Yes, we can end TB, led by the country. Now, this screening activity is a typical example of how a country could lead this effort. I'd like to thank NCDPHA for taking the lead. In the history of this country, systematic screening initiative has been implemented, but this is the first time you have an NCD taking the lead to implement the activities.
While it is important to work with innovative technologies, the collaborations with all key stakeholders and partners in the TB space is significant as well. Partners like the WHO, World Vision, Bennett Institute, the Global Fund, Department of Foreign Affairs and Trade, or DFED, and others play a vital role in ensuring the government meets its goals in reducing the number of TB cases in the country.
Here in NCD, one of the highest TB burden areas in the country, and we are screening and detecting cases early, even starting on treatment. So this year's World TB Day theme is, yes, we can end TB, led by countries and powered by people. So for Papua New Guinea, this means strong government, leadership, and practical action at community level. As we heard last week, our minister had the honor to meet with members of parliament through the parliamentary TB caucus. And the discussion at the caucus was to reinforce what we already know, that TB remains one of the leading causes of illness and death in our country, and it requires urgent and sustained action. Ladies and gentlemen, current data shows the scale of the problem. Between 146 to 247 people develop TB every day. Around 140 people are diagnosed and started on treatment daily. So of those, only about 92 complete treatment successfully. Between 4 and 15 Papua New Guineans die from TB each day, with only a small number formally reported. And our drug-resistant TB continues to increase. Around 1 in 4 TB patients are children, and many cases are still missed, particularly in rural and underserved areas. People living in settlements, crowded living conditions with no proper nutrition are at risk of getting TB. Deep TB requires everybody's working together to fight against this TB. It's affecting every one of us. And these numbers reflect real impacts on the community. Families losing income, children missing school, and communities dealing with stigma and ongoing discrimination as transmission. TB notification has increased from 6,000 in 2008 to over 51,000 in 2025. While these numbers are alarming, they also reflect our surveillance system is strengthened and working. However, access to diagnostics and treatment is still limited in some remote areas. Surveillance and contact tracing must continue to improve, and overcrowded living conditions continue to drive transmission. Stigma also delays people from seeking care. So at the same time, drug-resistant TB is making treatment more difficult and more expensive. So in response, government through the Ministry and National Department of Health, together with Parliamentary TB caucus and partners, is strengthening the national response. And we are expanding access to diagnostic, including point-of-care testing, ensuring uninterrupted treatment and drug supply, strengthening TB clinics, isolation facilities and outreach services, increasing community-based screening, including in high-burden areas like NCD, improving public awareness so people understand TB is preventable and curable, working with media to improve accurate reporting and public understanding, engaging community groups, churches and other networks to support awareness and early care, addressing broader factors such as overcrowding and access to services. So the Parliamentary TB caucus has committed to strengthen leadership, increasing domestic investment, improving oversight and preparing for new tools and treatment, including shorter regimens and future vaccines.
The government is asking communities, health workers and provincial leaders to work together to improve testing, reduce stigma and make treatment easier to access. Worldwide, WHO estimates 10.7 million people got TB in 2024 and more than 1.2 million died, and PNG remains one of the worst affected countries in the Western Pacific.
This year's global theme is Yes, we can end TB, led by countries powered by the people. This message reminds us that ending TB is possible. But it requires strong leadership, strong partnership, and the active participation of our communities. Tuberculosis, as we've heard from our colleagues, remains a serious public health challenge in Papua New Guinea. In 2024 alone, Papua New Guinea diagnosed around 40,000 people with tuberculosis. And sadly, 1,380 people lost their lives. In 2025, the number moved up to 50,000 cases of TB, and the numbers are increasingly year by year. Behind these numbers are real people, our families, our communities, and health workers who continue the fight in this disease every day of our lives. But the good news is TB is preventable and curable. With early screening and diagnosis, effective treatment, and strong health systems, we can save lives. TB can be prevented, TB can be treated, and TB can be defeated. Papua New Guinea has made important progress. PNG has already adopted the WHO recommended innovations to strengthen the fight against TB.
TB remains one of Papua New Guinea's most pressing health challenges, and it is among the top 30 globally for TB burden, with rising cases and increasing drug-resistant TB.